Hi, my name is Alexa Wood. My student ID number is 3388636, and this is my first video for Pathology 1. This is my maintenance of our lab equipment. So this is our urinalysis machine. It's already been calibrated last Monday, so we don't have to do that. But we're just going to wipe it down really good because we ran quite a bit of urine through it lately. So we're going to do that. So to do that, I just have normal 4x4s. I'll kind of separate them. So I have dry and wet. And then this is just plain alcohol. So to do that, just get these wet a little bit. So we'll take one of them and we'll pull out the tray. I'll just wipe this down really, really good on the outside, on the inside. Like this. We'll kind of sit back and let it dry for a minute, then we'll take our other one and we'll do the outside and then where the track goes in. So just like this. And then I'll always take my dry ones and kind of just dry off the whole urinalysis machine. Because we tend to use it right away in the morning, so I don't want that to hinder anything. Dry it off. Make sure there's no fibers. Make sure this is pretty dry. And we're just gonna pop this back in, just like that. Okay, so this is my blood draw. This is Sandy. She is here for not only a Heartworm Fest, but she's in our wellness plan, so she gets a big panel. So we got to draw some blood for that today. Oh, Sandy girl. All right. So we're gonna hold off here. I'm just gonna kind of, I know Sandy, I'm sorry baby. Feel around. Okay. Alcohol. Okay, and then we want bevel up when we go in. Good job. And we need a whole 3 ml. She pulled away, but typically I would hold off, withdraw my needle, and then my holder would hold off while I put this in the tubes. Okay, so this is my blood smear. So there's a couple things that we want to do when we make a blood smear. So in order to do that, I have my blood sample, I have my syringe, and then I have my slides that I'm going to need. So to make a blood smear, you want to use a very small drop of blood, and when you shove it across the slide, so your one slide is flat and then the other one is kind of like at a 45-degree angle, and so the drop of blood, you just back up a little bit, and then when the blood goes across your push slide, then you quickly in one swift motion push, and what you want it to look like is you want the edge to be kind of feathered, and it kind of looks like a rainbow. And one of the older techs gave me kind of like a tip and trick kind of thing, is that when you make a blood smear, instead of using a 22 gauge needle, use a TB needle, because you get a smaller drop of blood and then that's less risk of it being a bad blood smear. So we will go ahead and do that, and then after we make the blood smear, we'll let it dry. Once it's dry, we'll stain it in our stains. So our first stain is just the first stain that we go in. It kind of fixes everything to the slide so nothing moves. And then the second stain is kind of like a pink color, and it will stain everything that's acidic in the blood. And then the third stain is like a purple stain, and that will stain everything that's a base in the blood. So, and you want to put the slide in each of these for about 30 seconds. And then after that, you rinse it with distilled water and then let it air dry for a little bit. And then once it's completely dry, then you can do your count on the microscope. So do our blood smear real quick. Okay, so just a little drop of blood at the back of the slide. Just like that. Put my cap back on. Okay. And then the other slide, you kind of want to hold like this, 2 fingers on the side, 1 finger on top. So then hold this with your other hand. So we're gonna back the slide up, wait for it to go across, 1 quick motion. And then I kind of have that rainbow effect. I'll probably make another one because this one isn't good enough to stain, but kind of. So I'll make another one and see if I can do a better one. Okay, so this is my second attempt at a blood smear. So this one's a lot better. So this is the one we're gonna use for our count. So now that it's dry, we're gonna stain. So again, 30 seconds, 30 seconds, 30 seconds. Into the first one we go. The first one is again just to fix everything to the slide. For stain, this is just a little thing of distilled water. We're just going to rinse this off, front and back. Okay, so now that this is rinsed, we are gonna let it dry upright like this, so all the water will run off, and then once it is completely dry, we can do our manual count under the microscope. Okay, so we're gonna do our manual CBC. To do that, we have our smeared slide stained already. So the way you do this is you look at it, you're looking for white blood cells. So you count 100 and you record what each one of them are. So what we're looking for is clumps of red blood cells, microflaria. We're looking for just anything abnormal. So to start, you go on the microscope. You start on low power so you can find the monolayer where you do your count. Let's do that real quick. Okay, so I'm in my monolayer, and once you find the monolayer, you go up one by one and keep focusing in. So go up to our next one. Focus that in, go up to our high dry, focus that in, and then to go up to our oil, immersion oil, put that down, up to our oil, focus that in, okay. And then now we're here. So just from a quick scanning, looking around, there's no clumps of cells, there's no microflaria, there's nothing abnormal as of right now. But now that I have everything focused where it needs to be, I will actually do my manual count. Okay, so we're gonna do packed cell volume and total solids. So to do that, I have my blood sample. You could either do this with an EDTA tube like I have and just use untreated hematocrit tubes, or you can do it with whole blood and just use heparidized tubes. It kind of just depends on what your clinic has or what you prefer as a technician wise. So we have those things, and then we have clay to plug the end of our tube, and then this is the rotor that we use. So it has little kind of indents where the hematocrit tube sits. You'll put one across from the other to be balanced. And then this is how we read the Paxil volume when we're done. So to do that, to get everything ready, we need 2 tubes, and they're super small. Okay, and they have this little kind of blue line on them. That's where we're gonna try to get them, get our blood to. And we wanna make them as even as we possibly can. So to do that, we're just gonna take the top off of our EDTA tube, and we're just gonna kinda tilt it and wait for this to fill. Okay, so now we just kind of plug it and we put it in our clay. Put this down for a second. So we just stab it in our clay like this, and we twist, stab it again, twist, and pull it out. So then we're plugged. So there's our first one. And we'll just go ahead and put it in the rotor so we don't lose it. It has a little like cap on the top of it, so we have to take that off. Okay, and we want the clay to face outward towards the outside of the rotor. So just like that. So we got one, now we have to do the other one, get it as close to the amount in our first one. Fill, 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 fill. Okay, there we go. Plug into our clay. Poke, twist. Poke, twist. Set it across from our other one. Put the lid on. Okay, clay out, so now it looks like that. We'll set it in our centrifuge, set it for hematocrit, let that spin, and once it's done, we'll read it. Okay, so for the total solids, once everything is centrifuged, and you read the Paxil volume for the total solids, there's gonna be serum right above where the Paxil volume is. So what you're gonna do is you're gonna break the hematocrit tube, and you're gonna put that onto your refractometer, and then you're gonna read it just like you would like a drop of urine, except there is a different grid, and our grid just happens to be to the right of the urine. So we'll do that when it's all done centrifuging. Okay, so everything is done centrifuging. I'm just gonna leave it in here with the lid on so it's a little easier. Okay, so the red to red is our Paxil volume. This little white itty bitty piece right at the top of the red, that's our Buffy coat, and then everything else is our serum that our total protein is gonna come from. So it's kind of hard to see, but this is clear right here. So to do our Paxil volume, I'm gonna take this out, dump these out. And to read the Paxil volume, we use our handy dandy little disc, and think about it as you want to go red to red. So you want to go to the red, right where it starts above the clay, and right under the Buffy coat. And you kind of just do that on the little grid here until you find where it fits. So we'll just do that real quick. And you kind of have to move it a little bit to kind of get it to fit. So this is gonna be a Paxil volume of 32. Now to do the total protein, again, we have our refractometer. We're just gonna flip this up. I'm just gonna leave it in the box here for a second so I don't drop it, and it's easier for me to break the tube with 2 hands, obviously. So we're gonna break this hematocrit tube right above this little white Buffy coat. And sometimes it's really hard to get the serum out of the tube for some reason. Sometimes it doesn't really like to come out. like I said, the tubes are so little that it's really hard to get. Okay, so we have a little bit. Hopefully that's enough. If not, we'll break our other one and see. So you just kind of look up at the light like this. Okay, and we're at a total protein of 8.
Hi, my name is Stephanie Hagler. I'm Alexa's preceptor. Things are going well. She's completing her skills and improving upon them and learning more every day.